So why did you become a doctor, Dr. Johnson?
I had no family members who were physicians, but I, even from an early age, wanted to be a physician. I think I became very attached to my family doctor, who was a former Worcester physician. He was Dr. Jonathan Ward, who was the grandfather of Alan Ward, who he used to work in Worcester. He used to talk to me a lot about medicine, and it's just something I always wanted to do. I don't really have a stock answer to give you.
Okay. And where did you go to medical school?
Went to medical school at the University of Pennsylvania in Philadelphia, and graduated from Harvard College and the University of Pennsylvania, and finished University of Pennsylvania in 1957. Took my internship at the hospital at the University of Pennsylvania, a residency the same place in OBGYN, and went in the Army for 2 years, and was stationed out at Fort Carson, Colorado Springs, and practiced OBGYN in the Army, and then came back to Worcester in '63, which was my hometown. I grew up in Worcester.
Okay. So that's why you practiced in Worcester?
Mm-hmm.
Could you describe your experience in the Army?
Describe my what?
Your experience in the Army?
Army experience was good. It was a time when one finishes residency, you have the impression that you know everything and can take care of everything, but that is not true. I think the Army kind of polished my skills and allowed me to digest a lot of the information and a lot of the techniques that I had used during residency, and it allowed me to do that. It also allowed my wife and my family to live a reasonable life for the first time. We had a little economic wherewithal, and it was a beautiful area, and I enjoyed it.
So what made you choose your specialty?
Chose my specialty when I was an intern at the hospital in University of Pennsylvania. I wanted to be I wanted to do something surgical, and my initial thoughts were that I would become a general surgeon. But two of my very close friends in internship had decided to go into the OBGYN specialty, and I eventually chose that. Because of our relationships and because of the enjoyment that I had when I spent time on obstetrics and gynecology during my internship.
Could you describe a typical day when you first started practicing here in Worcester?
A typical day in Worcester?
Yeah.
Well, it was difficult when I first came to Worcester because my partner became very ill and then was ill for the next 10 years. And so basically I practiced alone a lot of the times, and I spent a lot of time in the hospital. A typical day I'd make rounds, I would operate, I would then go to the office, and many times go back to the hospital for deliveries, go home and eat, many times get called and go back in again. It was a time in my early years which were very difficult for me from the standpoint of time spent in my practice and in the hospital.
You just want to go on saying?
Yeah, go ahead.
Oh, I'll go on. All right. So what were your hours like in a typical day?
Oh, there were some hours. Sometimes I spent 24 hours in the hospital. Other times I would just go in and make rounds, see the patients, go over to the office, and put in an 8 or 10 hour day. But I spent a lot of time in the hospital. I did not make house calls.
All right. Did you ever use the telephone to talk with the patient?
Oh, sure.
Okay. So what were your rounds like at the hospital?
My rounds?
Yeah.
I just think to be like any other rounds, I would go into the hospital in the morning and check the charts and check the vital signs, and then go around and see each patient and see how they're doing and discharge the ones who are going home, and pick up any problems. And I would call it a routine matter.
And how many patients did you have at one time in the hospital?
At one time in the hospital?
Yeah.
Oh, I would say the average number in those days, maybe in the 60s and 70s, would probably be about maybe 10.
Okay. And where did most of your patients live? Around here in Worcester?
Yeah.
Okay.
Also, a lot of patients came from Holden because both my partner and I lived in Holden, and we had a lot of friends there.
Okay.
And obstetrical patients very commonly would be referred by a sister or an aunt or a mother. Or,
Right.
most obstetrical patients, at least in that time, were not referred by other physicians. They were referred by friends and people we had delivered and so forth and so on.
Okay. So patients had the chance to choose their physician?
Chance to choose their physician?
Yeah. They were able to choose their physician?
You mean before they came to us? Oh, I imagine so, sure. They choose any physician, any obstetrician they wanted to, yeah.
Right. So what do you think it was like for your family to have a doctor in the household?
Well, it has advantages, has disadvantages. I think the advantages are that the family has an in to other physicians. In other words, I think my family got good care when they were ill. I also think that I was a little bit more lax in paying attention to some of their problems, although none of these things turn out to be any serious problem. I think I had 3 boys, and none of them went into medicine. They all thought I was, well, my time frame, my time schedule was such that I don't think any of them would ever go into obstetrics and gynecology. They used to look at me and think I was nuts.
Did you have any vacations?
Yeah, I took vacations, not very many in the early days because I was alone most of the time, but I never took a lot of vacations, maybe a week here, a week there, that sort of thing.
Okay. So what did you really like about your practice? What made you decide to keep being a doctor once you started practicing?
Why did I want to keep being
Yeah, what did you like
a
about it?
physician? Oh, I enjoyed obstetrics. I enjoyed practicing. I enjoyed talking to patients. I enjoyed the surgery. Obstetrics was a grand profession in the 60s and 70s before the malpractice business kind of made me very cynical about the specialty. But obstetrics was very satisfying. It was hard. We worked a lot of hours, but there was a rapport we had with patients that was close, and I enjoyed it.
So what is something that doctors seem to take for granted now in terms of technology that you didn't have at some point in your career?
Technology?
Yeah.
In OBGYN?
Yeah.
Well, I looked at that question over the weekend, and I was just thinking of what we had then. I think the three of the major advancements that we have now that we didn't have when I was a resident or an intern. We have ultrasound, we have sensitive pregnancy tests, and we have laparoscopy, amongst many other things also. But these are 3 things which made a great difference as far as our ability to diagnose problems, and it has made our lives a lot easier now than it was back in the early days.
What technology is still in use that you used frequently in medical school or at the beginning of your practice?
I can't think of anything. X-ray, maybe.
Okay. Did you always have access to the new technology in your field?
Well, as they developed, yeah, and yeah, we had early ultrasound at Hahnemann. My main base of operations throughout most of my career was Hahnemann Hospital, and we had ultrasound there early, laparoscopy, we had all those things.
Is there anything that you would like to see invented in the medical field, not necessarily in your own specialty, but anywhere?
Well, when I quit obstetrics in '86. I couldn't take the malpractice relationships, and I got out. And but so I don't know. I haven't done obstetrics in 14, 15 years, and I think they have been flirting with this technology, but I've always felt that there was some way they could monitor a fetal pH or a fetal oxygenation constantly during labor. I think maybe they may even have that now. I don't think they do. This would be a great boon as far as the practice of obstetrics. As far as GYN is concerned, we need a good tumor marker for ovarian cancer. We need something to be able to help us to diagnose ovarian cancer, which is the least common of all GYN malignancies, but it's the most lethal. And if we had some way of some positive or some corrective, effective tumor marker, in contrast to what we have now, the CA-125 is very not conclusive, and that would be important.
So what were the most typical illnesses that you dealt with in the 60s and 70s?
Same as now.
Could you name a few, maybe?
The illnesses: endometriosis, ectopic pregnancy, malignancies, irregular bleeding, vaginal discharge. I mean, OB/GYN is kind of limited in its, they don't have a whole gamut of diagnoses.
Okay.
But I think those things are the same.
And what has been the greatest challenge for you to treat?
What has been what?
The greatest challenge for you to treat?
When I started or now?
Or when you started first.
Probably ectopic pregnancy was the most problems we had, because we didn't have sensitive pregnancy tests, we didn't have ultrasound, we didn't have laparoscopy. It was kind of a situation where if someone came in with an irregular bleeding and pelvic pain, and you felt something, no matter how small or lesion it might be on pelvic examination, many times we'd wind up doing a laparotomy and find nothing. And so that was always a problem. And but nowadays we have, without all the things that I've mentioned previously, this diagnosis has been made a lot easier. As far as GYN goes, what was the most difficult thing now? Is that what you said?
Or, yeah, back when you started practicing,
Yeah.
or now it's changed at all?
Well, ovarian cancer has always been difficult to diagnose. It's a difficult problem. But those are about two things that come to mind.
So what do you see, or what did you see as one of the most important breakthroughs in disease treatment during your practice?
Important breakthroughs in what?
Disease treatment.
Well, I think one of the most important breakthroughs of the OC is oral contraceptives, but that's not treating a disease unless you want to call pregnancy a disease. We have new treatments for endometriosis. We have newer antibiotics for pelvic inflammatory disease. We have a lot more we can do for malignancies, oncology, GYN oncologists. These people are very helpful as to the way we handle GYN malignancies. I think those are some.
Okay. And have you seen any breakthroughs in disease prevention? Not necessarily in your own field, but...
How do you feel what?
Not only in your own field, but generally in medicine. What breakthroughs have you seen in disease prevention?
Disease prevention?
Yeah.
I don't think we've had a great amount of disease prevention in our especially except for the oral contraceptives, which are not only effective as far as contraceptive devices, but also reduce the incidence of endometrial cancer, ovarian cancer. But it's, I can't think of anything else.
Okay. What were some of the most important drugs that you used in your practice when you started practicing?
When I started, I suppose hormones to control irregular bleeding, antibiotics for pelvic inflammatory disease. We didn't have, the oral contraceptives came in after I started practice. We didn't have any good treatments for endometriosis. We had a lot of vaginal type agents we would use for vaginitis. Those are some.
Okay. Did you always have access to the drugs that you wanted
Sure,
to use?
yeah.
Okay. What breakthroughs in drugs have you seen, if you've seen any?
Oh, there's newer treatment for endometriosis. There's newer treatments for ectopic pregnancy. As I say, new chemotherapeutic agents, as I mentioned before, for malignancy. New oral contraceptives. Those are some.
How did changes in drugs and the drug industry affect your practice?
Well, other than utilizing newer agents, you mean? I don't think there's been any. I don't have any great thoughts about the drug industry.
Okay. Could you briefly describe attitudes towards smoking and cancer throughout your career?
That's changed considerably. The typical, in those days I smoked, everybody smoked in the 60s and the 50s, and the typical obstetrical patient would come into our office, and we would see them for their first new prenatal, and then I'd have them come in the office and talk to them about obstetrics and how we were going to handle them. And 9 times out of 10, I'd smoke a cigarette, and I'd offer the patient a cigarette. And have a big ashtray in between us, and we'd sit there smoking together. And it is, if you did that today, it would be incredible. I mean, the patients would think I was nuts, but they smoked also. And my wife smoked all during her pregnancy. And it was a different situation, but obviously, as the years went by, this changed, thank God. And now, obviously, things are different.
How did patients without money receive health care when you started practicing?
In the first day, in Philadelphia, they came to a clinic which we ran, as residents ran, and the same thing existed in Worcester. We had clinics, and we had a clinic at Hanneman, which took care of obstetrical and gynecologic patients. There was a clinic at City Hospital. I think there was a clinic at Memorial. I'm not sure there was a clinic at St. V's. There must have been maybe one there also, but so patients came to clinics, and occasionally they would come in, and because of some difficult times in their lives, they had lost their insurance. I would deliver them for no fee. But most of them went to clinics.
So you think everyone who needed care received it?
In those days, I think so, yeah.
Over the years, how do you think Worcester compares to other places in terms of providing care for the underserved?
Well, I think Worcester was just as good as any place else, yeah. I don't think Worcester had as, you know, you talk about a large city with like Philadelphia and New York. I mean, there were a lot more patients that needed help than I think than in Worcester. And but I think the facilities were there to take care of patients if they searched them out.
What were some fears and concerns about socialized medicine in the 50s and 60s?
Oh, I'm not a political person. I'm not in favor of socialized medicine, but I think it mainly is a matter of, I think it might destroy a doctor-patient relationship. And when your patient comes to you specifically on a fee-for-service basis, and seeks out your help for some medical problem, I think that there's a rapport that develops there, which is very difficult to reproduce, and it would seem to be difficult to reproduce in a socialized medicine quota type system, or if patients came to you because you were the neighborhood doctor. I think it also have some effect on the economics of practice, on the time spent in practice, paperwork. I think these things would make it negative for me, give me a negative feeling towards socialized medicine. Positive things of socialized medicine, it would give access to medical care to everybody. And, but I think the risks, I mean the negatives outweigh the positives.
So, did you ever see physicians get involved politically on the topic of socialized medicine?
Oh yeah. Yeah, I have a lot more friends who are more political than I am.
As managed care came into medicine along with Medicare and Medicaid in the 60s, how do you think physicians, patients, and generally people's access to care have each been affected?
Well, I think as far as Medicare and Medicaid, it gave access to care to elderly and to needy people. I think those were worthwhile things. Medicaid, I think, as when I was doing obstetrics, Medicaid was difficult for us because the return, the financial return of a Medicaid patient was not great, and I think that's changed, and I think it is more reasonable at the present time, and I have no problem with that. I see Medicaid patients, and obviously I see Medicare patients at my age, and I think both obviously both plans are here to stay.
Okay. So how do you feel just generally access to care has been affected by managed care?
About what?
How do you feel that people's access to health care has been affected by the government getting more involved?
Oh, I think that, well, obviously these two plans, Medicare and Medicaid, has given far more access to medical care than without them, yeah.
Okay. When did HMOs first impact your practice?
I don't remember. Maybe the 70s, 80s, I don't remember. I mean, we joined Central Mass, but I don't know when Harvard Pilgrim and all these other things, I don't remember when all those things came in, but I think it probably was in the 80s, I'm not sure.
Did they have an impact directly on you?
Yeah, the paperwork increased, our independence suffered a bit. I was always very unhappy when I'm not doing any surgery anymore either, but when I was doing surgery, I was always very unhappy about having to call somebody in a office in Boston or that was working for these HMOs, and to explain to them why I wanted to do a hysterectomy, and it always made me a little bit upset, but I must admit I got over that after a while. It became kind of the price of doing business, and I could handle it.
Do you have anything else to add on the positive or negative aspects of HMOs or generally managed care before we move on from the topic?
Well, I think the positive things are it probably reduced the cost of medicine to some extent. It has given probably people more access to care. It's probably supposedly cheaper medical care. I'm not sure that's true or not. The negatives are the paperwork and this peer review business, and the other concern me was about admission discharges. I always felt I discharged patients on time, but I was always when I was doing surgery, I was always at the end always worrying about how long the patients were staying in the hospital. Do I have to get them out? I didn't like that.
Well, moving on now, could you tell me how much it costs for you to go to medical school?
How much did it cost?
Yeah.
Well, tuition at Penn was, I went to the University of Pennsylvania, tuition at Penn was $600 a year. And I think I spent, I think room and board were something like $400 or $500. So probably $1,500 a year would be probably cover it.
Do you think the school, the cost of school influenced where or how you or any other physician that you knew at the time practiced medicine at first?
The cost of medical school?
Yeah.
No.
Didn't affect you at all?
No.
You know anybody who was affected back then?
No, I don't think so. People didn't get in debt then. Nowadays it's ridiculous how some of these students wind up in huge debt. And I'm sure it must affect their thoughts as to where they're going to practice and what they're going to practice. But we didn't have any problems like that, no.
How have doctors' salaries changed over the course of your practice?
Oh God, they've gone way up. I came back to Worcester in '63. I made $12,000 a year, and I was associated with one other physician, and I spent about maybe 3 or 4 years with minimal increases until I finally became a 50-50 partner with this physician, and then my salary went up a little bit.
So you've been in a private practice or a group practice? Or private practice?
No, I came back to Worcester and joined another physician, and we practiced together. Well, he was sick all the time, but we practiced together till '72, I think it was, and then the third physician joined us, and then a fourth physician joined us in '77, and we've had other physicians in this practice ever since then. Now there are 1, 2, 3, 4 in this group.
How do you feel that's affected you in your practice?
Well, it hasn't. Since I gave up obstetrics in '86, and you know, at that point, my time became. I had a lot more time to deal with things, and obstetrics is not easy. And but nowadays, nobody. I mean, the other thing about practice in the old days was when I first came to Worcester, it was unusual for obstetricians, gynecologists, OB/GYN people to have partners. They all practiced solo. And I developed friendships with a lot of guys in town who were, 10, 20 years older than I was. And these guys spent all their time in the hospital. They never went home. I mean, they had big practices, and that's just the way of life. I mean, they just spent a lot of time. And I think nowadays, I think for the betterment of the specialty, the people live a more moderate lifestyle there. They work in larger groups. There's coverage arrangements. They're able to deal with their families better than we did. I think it's just a better lifestyle.
What were the typical fees for an office visit when you began practicing?
Office visit?
Yeah.
I don't remember. I think it was $5 or $10, something like that.
Do you remember what out-of-pocket expenses you had for your practice?
Out-of-pocket expenses?
Yeah, I don't know this question.
I don't know what that means either.
Alright. How has malpractice insurance, as well as it's done doctors' practices, changed over the years?
Oh God, it's been
Maybe
terrible.
some comments on
It's terrible. It's the biggest threat we have now to physician well-being, it seems to me. We got to get the trial lawyers out of the pocket of the get the trial lawyers out of the Democratic Party's pocket or something or other, something along that line. But malpractice rates have absolutely become astronomical. And there are about maybe 10 or 11 states who are being threatened with an inadequate number of OBGYN people because of this whole situation. Something has to be done about that, and I hope it is over the next 10 years. I think it's very important. It colors all your thinking. I mean, it's like playing Russian roulette in obstetrics. If you're not sued and if you've been an obstetrician and have not been sued, you're a very unique person. The average obstetrician gets sued 4 or 5 times, and it takes a lot out of you. At least it did me. If you've got a personality, most physicians have kind of a I don't know, how would you call it, well, they have a personality that doesn't deal well with malpractice suits, and I didn't, and it changed my thinking about a specialty which I really loved at one point, and into becoming very cynical about it. But that's a huge problem right now. Thought it was being solved about 5 or 10 years ago, but now from my reading and looking at malpractice rates throughout the country, it's getting worse again.
Okay.
Particularly in our specialty of OBGYN, obstetrics particularly.
Yeah, I'm sure there aren't too many doctors who would deal well with this suit.
Oh yeah, it's difficult. They say, you know, you should deal with this as just the price of doing business. I have difficulty with that. I could never do that, and so that's why I got out of obstetrics.
All right. Well, how do you think you've learned the business of medicine, if you've learned it at all, really?
I don't know if I've ever learned it. The person that I joined back in '63 had a fairly knowledgeable way of handling the business arrangements of a practice. And of course, I really wasn't by myself ever. I always had this individual to deal with, and then there were other people. So any business decision we made in the practice was not one that I made solely. It was by 1 or 2 or 3 or 4 other people, plus myself.
So how has women's health in Worcester changed over the course of your practice, generally?
Women's health? Oh, I think as far as the technology we have now has made the care of women, certainly it's improved the care of women tremendously. We've had also improvements in neonatal care with the NICU, the Neonatal Intensive Care Nursery. Sterile care has improved, all the technological improvements in gynecology with ultrasound, laparoscopic surgery. It certainly has improved considerably, I think.
Would you care to comment on changes in children's health care at all?
I don't have much other than NICUs, neonatal intensive care nurseries, which have been very helpful in the care of the premature infant. As far as pediatric care, I don't have any knowledge of that. I'm sure that's improved too.
What were public perceptions of doctors like back when you started practicing, and compare them to?
I still think doctors are respected people in the community. I think the majority of doctors are responsible, ethical people who do an excellent job in healthcare, and there are exceptions. I don't know whether our perception is as good as it was back when I first started, but I don't know. It's an interesting question.
How do you feel the role of the physician in the Worcester community has changed, if you've seen it change at all?
Has changed?
Yeah.
I don't know. I mean, we took care of patients then, we take care of patients now, and I think probably, I don't know whether some doctors are more political than they used to be. Might be.
Are Are there Worcester physicians that you admired when you started practicing?
That I admired?
Yeah.
Oh yeah. I say one of the reasons I went into medicine was because of this general practitioner I had, Dr. Ward, who was a peach of an old guy. Yeah, I admired a lot of people in Hahnemann Hospital. And usually they were people who had got along in age and were still active and bright and were helpful as far as teaching and so forth and so on.
What was it like for the female physician in Worcester?
There weren't any. There were very few. That's been a major change, and for the better, I would say. When I was in medical school, we had two female residents, two female medical students, out of a class of 110, 120. Get back to Worcester. Offhand, I can't remember any female physicians. There were some I know, but I can't, at this particular moment, remember any of them. Now, of course, this has changed radically, and I think that I don't know what the medical student ratio is, but I think it's in favor of women now, and in our specialty of OBGYN, I think in 10 or 20 years, a male is going to be an anomaly. I think that, you know, the residencies are 80, 90% women. You read the journals of job opportunities, and a lot of times they'll say women only, or a women's physicians group need another woman. It's a specialty that has seemed to be, obviously for obvious reasons, attractive to women, and they're going into it, and there aren't many men who go into this specialty anymore. At least I don't think, from my observation.
Okay. What are some changes that you've seen in the demographics of Worcester?
I mean, as far as population stuff?
Yeah.
I think probably there's more. I grew up here, and when I was a kid in Worcester, it was a French, Irish, Italian, Swedish, Polish, Northern European type city. Obviously this has changed dramatically. We have now a large percentage of Hispanic and Afro-American, and not so much Afro-American as Hispanic, I don't think. But it's different. Different.
And has the ethnic backgrounds of your patients changed over the years? Or how has it changed?
I practice it. You know, my practice is usually an older group of people, and it hasn't changed much.
How has Worcester been different from other places that you've practiced? Have you really practiced anywhere else?
Well, I did a residency in Philadelphia, and I was in the Army for 2 years, which was obviously a trapped population. There was no way of comparing Colorado Springs with Worcester. I have no way to judge that.
Okay. So what do you like best about practicing here in Worcester?
What do I like best about Worcester? I like Worcester. Always have. That's why I came back here. I think it's a great place to live, and as far as the practice of medicine in Worcester, it's I suspect I could be happy anywhere once you get to know the people, but the facilities are here, the consultants are here. It had everything that I needed to practice medicine in a competent and an efficient manner.
What do you like the least about practicing here?
What?
What do you like the least about practicing in Worcester?
The least about practicing in
Is
Worcester?
there anything you don't like?
Oh, maybe some of the things we've spoken about is in previous comments that I made, but I can't think of anything specific that I would bring up.
Do you have any fond memories or a favorite memory that you'd like to share from your career in medicine?
I remember Hahnemann Hospital. I looked into that question. I was just thinking about that question on Saturday. I think one of the fondest memories I have were the staff at Hahnemann Hospital, the OBGYN staff at Hahnemann Hospital back in the 60s and 70s. We were a very close-knit group with great rapport, and spent a lot of time in the hospital together. And I enjoyed going to the hospital. And that was one of my favorite memories.
Do you have a least favorite memory that you'd like to share?
Yeah, I thought about that also. I don't know what I thought. Oh, I know what it was. The least favorite memory, I had a maternal death back in the early late 60s, and this woman ruptured her uterus and during spontaneous labor, and we had a very difficult time with her. We eventually lost her. And I can remember that day. I didn't get over that for about 6 months, and thank God it never happened again.
Well, with medicine being such a changing and growing field, how have you seen yourself keeping up with the changes in terms of education, like right after you graduated, even now?
Oh, I mean, medicine is a constant search for knowledge and bettering yourself and being a better physician, diagnostician, etc. And I think the vast majority of physicians do that. They read, they go to meetings, listen to tapes. I mean, I think it's not a occupation that you can say, okay, I've got it all now. You've got to keep going. And I think most physicians do that. We now have a program to get a license. You need a certain number of educational credits to do that, and I think most people do that.
Could you name some of the publications that you've been reading or the tapes that you've been listening to?
Well, it is all the obstetrical journals. I read the ones that I read pretty faithfully are the Green Journal in OBGYN, the Survey of OBGYN, the Contemporary OBGYN, Women's Magazine, there's a couple of other these throwaway type OBGYN journals, which I read. I also skim the New England Journal of Medicine, and that's about it.
Okay, thank you. All right, well, we have about, let's say 8 minutes left, and before we wrap up this interview, are there any other stories you'd like to share from your career in medicine, or even talk about your residency or internship, or anything you want to say before we end this?
Oh, there are a lot of funny stories, but I mean,
That's fine. Go ahead and share some of those if you think they're appropriate.
no, I think we'll stop there, or just get on to the next question.
Okay. So, lastly, what advice do you have for younger doctors just starting their practice?
I think that one of the things that I've thought about as the years have gone by is that doctors have become negative about the practice of medicine. I noticed that I would occasionally go to lunch at the hospitals that I went to, Memorial and Hahnemann, and just a typical day, I would feel pretty good. I'd go in there and listen to this lunchtime conversation, and I'd come out of there feeling lousy. A lot of negative comments about practice of medicine, some of which were warranted, but I've heard physicians say they would never tell their sons to go into medicine. I never felt that way. My sons never went into medicine, but that wasn't because of me. I still think it's a good profession. I still think it's an honorable profession. I still think it's a profession where you, despite the fact that everybody claims we've lost independence, we're still a pretty independent lot, and can still, you know, guide ourselves and do the things we want to do. I still think it's a very honorable, worthwhile profession for someone to go into. And I noticed that the applications for medical students are down almost 50%. And I suppose it's because they can make kids can make a lot more money with computers and all the other .com stuff. But I hope that it will continue to attract bright people who are interested in the field, and this thing can go on, because I think it's a good way to good life.
How do you feel about the state of medicine right now in the year 2002?
Well, I think as far as technologically speaking, it's sound. I mean, I worry about the diminution in people who apply in medical school. I worry about that. I worry about malpractice. It's destroying obstetrics and gynecology in certain parts of the country, and something has to be done about that.
So do you think you'd do it all over again in this day and age? Go back and
Yeah, I think I would. I don't know whether I'd go into obstetrics. As I said, at one point I loved obstetrics, but after I got hammered, I became a little cynical about the specialty, and as I say, I got out of it in '86. I think you know, when I think back on it, all the birthdays I missed and Christmases I missed, and the time I spent away from my family, and I don't know whether I'd do that again, because it seemed to me at one point, after all this, I just got hammered 2 times by suits which I thought were not what should have been the case, and but I became kind of cynical about obstetrics. But whether I would go into medicine again, and I would certainly give some thought as to what specialty I would choose, but I'm not so sure it'd be obstetrics.
Okay. Well, that brings us to the end of our interview. Thank you very much.
Very good.